The COVID-19 pandemic is raging on across the country. The average amount of new cases nationwide more than doubled in the last month, from 11,500 cases on June 20th to nearly 38,000 this week.
The really sad thing, though, is, if we had maintained the vaccination rates that we were seeing in April, this all would have been done. We would have reached herd immunity by the third week in June. And this would never have happened.
Dr. Thomas Unash is an infectious disease researcher at the University of South Florida who has been forecasting COVID-19 trends in Hillsborough, Pinellas, and Pasco counties since the beginning of the pandemic.
The last 3 weeks have been the worst that I've seen since I started doing the calculations last summer.
The Florida Department of Health is only releasing the amount of new COVID-19 infections once a week now. They used to report them daily. In the last 2 weekly reports, the amount of new infections increased from 23,000 to 45,000 to 73,000, averaging more than 10,000 per day.
We're in about halfway up what's going to be a really steep wave in infections. Which is really being driven primarily by infections in the unvaccinated people.
He says this is the fourth wave and anticipates it being the biggest one. Fully vaccinated people are still being infected.
The ones that actually have a good immune response to the virus are getting like 2-day sniffles.
But he says unvaccinated people who are getting infected are having severe cases, which is causing hospitals to fill back up across our state. There is a light at the end of the tunnel, though. Unash says the virus is going to eventually burn out, with people getting infected or people getting vaccinated.